Good evening, everyone. My name is Michelle Galazewski. I'm a Partner Relations Director with Eversight, and on behalf of everyone at Eversight, I would like to thank you for joining tonight's program, Restarting Your Practice with an Effective Communication Plan. In an effort to eliminate all background noise, all participants will be muted throughout the duration of the webinar. If you would like to ask a question, you may do so by typing your question into the Q&A panel at the bottom of your screen. We will address all questions at the end of the program. At this time, I would like to introduce our speakers for this evening. Jill Marr is the Principal Consultant and owner of Marr Medical Consulting. She has more than 25 years of healthcare experience and consults with medical practices and teaching institutions to help them achieve their business goals. Jill's expertise includes strategic planning, financial analysis, physician and administrator recruitment, marketing, leadership training, team building, sales training, business development, and overall practice efficiency. She is well-versed in strategic planning and marketing and holds a certified ophthalmic executive certificate. Ryan Schumacher is the founder of Satisfied Patient, a service that helps healthcare practices get online reviews and actionable patient feedback to improve patient experience to get more new patients, retain existing patients, and lower cost. He works with some of the top ophthalmology practices in the US and is passionate about the patient experience. Also joining us at the end of the webinar will be Dr. Lorenzo Cervantes. Dr. Cervantes is a board-certified ophthalmologist and a fellowship-trained specialist in cornea, external disease, cataract, and refractive surgery. He is also a medical director for Eversight. In October of 2017, Dr. Cervantes joined Dr. Joseph Sokol at Connecticut Eye Specialists in Shelton, Connecticut to help provide some of the most up-to-date cornea and cataract care in the region. He has recently reopened his practice, implementing many of the safety guidelines you will learn about this evening, and he is here to tell you how things are going. Jill and Ryan, I'm going to turn it over to you now.
Oh, thank you very much, Michelle, and thank you so much to Eversight for inviting us to present on this topic, restarting your practice with an effective communication plan. Restarting is kind of an interesting word at this point because I realize that we have practices from across the country who are at all different stages right now. And really over the last couple of weeks, I've worked with quite a few ophthalmology practices who have said that over the last 8 to 12 weeks now, that they've really gone down to about 10% of their patient volume and are slowly building up again. In the last week or so, I'm talking to practices that are anywhere from 25 to 75% of their normal patient volume. And, you know, obviously, Ryan, I think when you and I had talked, what was it, 12 weeks ago, you know, we kind of thought that we would just stay in place, and after these 8 to 12 weeks are over, we just flip a switch and everything would go back to normal. And I think what we're realizing is that this is such a different type of normal than we've ever been used to, obviously, and kind of restarting patients and getting them to kind of get over their fears and their anxiousness and that uncertainty is going to take some time and certainly a lot of effort on the part of practices, right? So,
yeah, and I would just add one quick thing in there too. I mean, it's exciting right now since the last time we did this, a similar webinar, Jill, just in terms to see how our clients across the United States have kind of already started to get back to reopen. And it's so I can't wait to share some new insights today that we've learned.
Yeah, and I think some are moving a little bit quicker than I think we had anticipated even a few weeks ago, which is great. So we're going to talk a little bit about restarting a practice among COVID-19 and how that's going to require really a strategic approach to patient communication that's really detailed, reassuring, and drives operational excellence. We'll talk about patient communication and really how critical that is to help restart and ease patients' concerns to bring them back into the office because they are very nervous right now. So the more that we can do to reassure them, you know, the more likely they're going to come back, hopefully at a faster pace. So today's webinar, our goal is really to help practices achieve a successful restart by delivering an effective patient communication plan. And what is that patient communication plan? We're really going to take a look at what information is key to communicate with your patients. We'll talk about best practices for patient communication across your marketing channels. And we've seen a lot of different practices over the last few weeks that hopefully will be helpful as well. And then as a little bonus, and I can't remember if we talked to Michelle about this or not, but we do have a free patient communication plan that can be edited specifically for your practice in like an Excel spreadsheet. And so we can certainly provide that as well to make this whole process much easier for you.
Yeah, that's right, Jill. And I'm excited, as I know you are, to have Dr. Cervantes on too. I mean, a great opportunity here firsthand, from a doc who's running a practice, who's in it, who had to develop a strategy from the top down with no blueprint really, right? And so, we've had the benefit of coming into this from a patient feedback perspective, having the analytics, having the data, to help kind of drive some of this. So I'm excited to hear him at the end of this as well.
Yep, absolutely.
The first thing, as we talk about with the patient communication plan, we're really going to talk through 3 key messages. And we're going to put a lot more emphasis on the second and third message right now. And taking those messages, answering 3 key questions, creating 3 key messages for your patients, and then infusing them throughout each one of the patient communication channels shown here on this slide, everything from your website through social media, email, scheduling. And you'll hear me throughout this presentation talk about communication channels and marketing channels synonymous with one another. They're all essentially the same. They are an avenue for us to communicate critical information to patients. So that's really the framework that we're going to provide today. And the 3 key questions, first one being, what patients are we seeing? And I know just in the state that I'm in, it's hard to know what's open and what's not open. And with ophthalmology specifically, there was a time period where it was emergent and urgent only. And then we've transitioned out. So you've got that on top of stay-at-home orders, and you've got independent practices making their own decisions too, right? As far as when is it right for us to open up. So the first key question is what patients are we seeing? Second one being, what can you expect when coming to our practice? This is a very important one as well. And this has really escalated over the course of the last 2 weeks as more and more practices have opened, stay-at-home orders have gone away. The last one, and there's been some really phenomenal insights that have poured in the last 10 to 14 days, but what extra steps are in place to keep all of us safe? So those are the 3 questions that every practice, and I think Dr. Cervantes will talk about it at the end here as well, how they've used these questions, and they've developed a framework and these answers to then communicate through all their channels.
Absolutely. And just to go over like number 2, in terms of expectations, patient expectations are so important. Whenever doing customer service training, we always talk about patient expectations around what that wait time looks like, and to make sure that those expectations are realistic. I think the expectation now is really talking more about the safety measures and what's in place so that patients have realistic expectations walking in the door.
Yeah, Jill, you had an experience, an unfortunate event. Thank goodness your husband's okay. But you had an experience with your husband where, you were calling in advance, right? You were calling to these practices. You were in urgent need, and you weren't getting a lot of good information on the back end as far as what safety measures were in place, right?
Yeah, no, when he cut his finger on a Sunday evening cooking dinner and we had to call urgent care so we didn't have to run into an emergency room, I was hoping urgent care would give me a lot of guidance when I called ahead of time. And they really did not provide the information that I was looking for. I wanted to provide them with our health insurance ahead of time over the phone and with my husband's information. And I wanted to make sure that he should wear a mask and things like that. And they just did not provide that information, unfortunately.
Yeah, that first patient touch point today is more important now than ever before, whether they're going to your website or they're calling and speaking to scheduling, or they're, having a discussion with your screener, right? Because you have screening at the front door. It's very important. So that expectation, setting, as you mentioned, is very, very, very important. We'll talk through kind of the answers, right? So this is a framework. This is where you can plug and play your answers into these three key questions, develop your three key messages. The first one, and again, this is a pre-stay-at-home order lifting answer, right? So it's at this time. Who are we seeing? We're seeing the emergent and urgent patients. How do you get an appointment? You call us. At the time, there was a statement from the American Academy of Ophthalmology, recognizing these unprecedented times, and then also communicating telemedicine. So if you're using telemedicine services, letting them know that that's available. And then lastly, the COVID-19 exposure statement. So what patients are we seeing? It's one of the biggest things now is we are open, right? So as you drive around town in your local community, and particularly from the restaurant category, you're seeing these signs, right? And every corner that says we are open. And it's like they have not been open, obviously, for quite some time. But that's a main message. And as we communicate, we kind of switch gears here into 1B, what patients are we're seeing, and we're ramping practices back up to seeing all patients. It's still important to let them know, because again, the mindset of the patient is, I'm not sure what's open and what's not open. I'm not sure if they can see me or they can't see me. So don't assume that they know you're open. That's kind of one of the big takeaways too that we've learned over the last few weeks as ophthalmic practices have started to open up here. The second piece of this, again, if you're doing telemedicine, a great opportunity to continue to communicate that to your patients. Dr. Cervantes has got a great video that those guys have done. They're utilizing it in their practice. And you'll see it at the end, and I'm sure he'll share his experience with you. And it's a great opportunity for him to also ease the patient's concern for their next visit when they come in. So not only is he likely diagnosing their current condition, helping them out like he's always done, but he's has the opportunity to help set that expectation around all the safety measures that they have in place at their practice in Connecticut. Lastly, COVID-19 exposure, again, including that, a very easy clickable link over to the CDC guidelines. Again, all of this is in the patient communication plan that we can send out. It's all completely editable, so you can adjust that as you see fit.
Perfect.
As we move on to the second question, and this is becoming the biggest question, it's number 2 is now number 1, and what can you expect when you come to our practice, right? So we've got, masks, no masks. So what is the policy there? Screening, will they have their temperature taken as they come in? Waiting room, what is the waiting room policy? I've seen it all. We've got social distancing happening in waiting rooms. We've got practices where you can't come you have to wait until 10 minutes prior to your appointment to enter the building. So there's a lot of different policies in place. One of the top pieces of feedback we continue to get too is the companion component. So it's tough, right? You want to limit the amount of people in the practice, and when someone shows up with 5 family members for their exam, you got to tell them, unfortunately that you might not all be able to come in this time. And again, social distancing being the last one. So again, you could customize this template, make it work for your practice, but really these are the key things we're recommending here.
Yeah, and I think they really have to be communicated to patients at numerous times throughout the process. When the appointment is scheduled, when there's a reminder call to the patient, they need to be reminded of all of these because this is such new stuff that they've never encountered before. So the more it can be communicated, the better.
Yeah, and it's a great point, Joan. The other thing I'd add to that is it's not consistent, right? So your ophthalmic practice might not be doing the same as what they just experienced at their OBGYN.
Right, or at the hair salon.
That's right.
All different.
Yes, all different. You're right. I finally did get a haircut. you know, the next one here, what extra steps are in place to keep all of us safe? You know, there's been some interesting learnings on this, particularly over the last few weeks. And the first one is, you know, having a strong statement on not only that you're trying to keep the patients safe, but it's all the staff and doctors as well. So a strong statement on your safety along with everyone's safety, right? So we're all in this together. The infection prevention precautions. So again, this is an editable statement here, but you know, they want to know what is being done to help keep them safe. The check-in procedure you know, is there a check-in procedure? I know a lot of practices now have almost concierge the service. So they have staff that is purely making phone calls. They've eliminated, you know, almost all paperwork whatsoever. They're actually providing and capturing even more data from the patient than they were before, which is really phenomenal to hear from some of these practices we work with. But online patient intake forms, so, you know, is there an opportunity to put those on your website, have patients complete those in advance? I know my wife specifically has had a couple experiences during, you know, the last 60 days where she's tried to fill out paperwork in advance before her appointments and hasn't had that opportunity. And as you know, one experience wasn't great. The other experience, they gave her the pen and they said, listen, you know, keep the pen. And so that just gave her that extra sense of, look, these guys have thought through everything at this practice. Yeah. So it's very important. And the one last thing I'll share on, you know, the extra steps to keep all of us safe, Jill, is, you know, one of the other big insights we're seeing right now is patients actually want to see practices, you know, sanitizing. Mm-hmm. And, you know, Dr. Cervantes can talk about this. I can't wait to get his answer at the end of this, but it's one of those things. He's got a video on his website that, again, sets the patient expectation. They answer pretty much these 3 questions. They do a great job at it. And one of the things they do outside their exam rooms is they've got basically an 8.5 sheet of paper, and it says sanitized on it. And they've got it folded over the doors. And so prior to the patient going in there, the patient visually sees that it's been sanitized. Now, again, you're told all this. You may or may not have looked at their website. You may or may not have watched their video. But one of the big things we're finding right now is, you know, even prior to having a screening with the temperature gun, you know, patients want to see you wipe that down before you use it on them. So it's a little bit like that dishwasher magnet that says dirty or clean that you can turn upside down. That's it. That's it. Kind of fun too. That's it. That's it. So, you know, we'll get Dr. Cervantes' you know, take on it at the end. And again, I don't know if, you know, they intentionally did that by design for the patient. It was probably more a staff, you know, component, right? So a notification system of the staff being like, hey, this room is open. But what they did is they hit a grand slam because patients are looking at that, seeing that, saying, wow, this room is sanitized, because there's so many visual learners. And that's, you know, one of the big things. You can tell them one thing, but when you show them, it makes for a different experience. Yeah, good. Now that we've got these 3 key messages throughout your practice, we're going to infuse them through each one of these touch points, and we're going to walk through each one of these. First one being a website, and the website is, you know, doing all your heavy lifting. It's your best place to do this, because it's not going to end, right? This is not something that is going to go away next week. It is definitely, you know, going to be around, and a great opportunity to, again, answer these 3 questions. I'll show you a couple examples of websites here on the next couple slides, but including the date. So one of the biggest things I'm seeing right now is visiting practices websites. I'm seeing dates on there, which is good, but they're very old. Yeah. And so I don't know, you know, I'm seeing sites that say, hey, this was updated March 28th. This was updated April 15th. You know, it's going to be June 1st here next week. So it's one of those things, you know, go out there, make sure your site's up to date, make sure you're answering these 3 key questions, put the date on it when it's been updated. Driving back to this patient education page is should be done in all your digital communications.
And I think the other thing too I'm seeing on these web pages or these websites is the page that just kind of pops up over the top front page of the website, and it kind of looks like a skull and bones. It's very scary, and it says COVID, we're closed. And
Yeah.
that's kind of the message we want to get rid of now, and change it so that it seems a little more open and inviting, as kind of the closed go away message that they had back in March.
Yeah, it's kind of like a giant red stop sign, right? So
Yeah.
it's like, hey, stop, don't call us, don't contact us, just read this. And you may or may not be able to read it based on how it is. You're right, Jill, it's a great point. And one of the other things too that is sometimes a challenge with those pop-ups is how they work on mobile. So I spent 15 years at a wireless, a mobile company. And, everything should be designed for mobile. So it's, that experience on mobile versus desktop is completely different. 60% of ophthalmic patients are accessing your site on their mobile device.
Right.
And so that's a big key to make sure that that's there and that's up to date. One of the great pieces of your website, again, at the top here, we've got an alert header you can see. And it just says important patient updates on COVID-19. And that's an alert header that would go throughout every page of your website. You'll see it again on the next example. And then important patient updates. I feel like a little bit, maybe it's just me and maybe I'm on the internet too much right now, but everybody says important COVID information. Mm-hmm. And it's wallpaper, right? It's turning into wallpaper for me.
I ignore it now when I see it.
Yeah, and so you really need to use the patient. You need to use the word patient. Anything you can do to draw their attention to it. You'll see a great example. They put it in red font on the next Praxis website we're going to show you in a minute. You'll see the date there. You see the 3 key questions, and then answering those 3 key questions down below. So tell them what you're going to, tell them, and then answer each one of those using the 3 questions. That way they know. Another great example here, again, nice approach. We're seeing patients, important information update regarding COVID-19. That's kind of where everybody's falling at in right now. And I just do think that, emphasizing that about a patient, important patient updates, right? Because it's going to be changing. It's going to be changing over time.
Absolutely. We're back. We're open. I love seeing those words. They're very inviting. Yeah,
it's, your website is your lowest cost channel, right? Mm-hmm. So it's your lowest cost channel. It's your employee who never complains and they work hard for you. So, making sure it's up to date is critical right now, and answering those 3 questions. And there's so many examples that we have from clients and experiences. We'll talk about the scheduling one coming up, but driving back to that website's key. And here's another example, right? So, I know, Jill, you've gotten inundated with, a ton of email messages, right?
Oh, yes.
Bank of America, hey, we're here for you. You can deposit your check online. Well, great. I've been doing that for 6 years now. So thanks for letting me know. But, it's email communication is so great if you just stick to your one thing. So what's your one thing? We are open. As of May 11th, we're open. We're seeing new patients. Contact us to make an appointment. You can reinforce what they can expect in that email as well. Definitely recommend that. And then you can link over to that COVID-19 patient education page so they can learn more about it. Great opportunity.
Ryan, I have to say, so like over the last, I'd say 12 weeks or so, I mean, the number of subject lines that say COVID-19 from different companies, I mean, I must have hundreds of those, but I think I've only received 1 or 2 from maybe, a physician office or something where I go that says we're open. That's a great subject line. That's going to get my attention. Yep. And those were the ones that I actually spent the time reading, as opposed to all of those others that I feel like I've already kind of read all the same information over and over again.
Yeah, that's it. I mean, again, it's wallpaper, right? Stand out, be different. And it's, we helped Nashville Eye Associates in Nashville do an email blast to their patient base. And, again, subject line was, we are open. And it had a 44% open rate. And if, again, people don't believe that, but it's true. And it's one of those things, a very subtle message. It was from the doctors. Dr. Fontes has got these guys got a great video that they made for their patients sitting out there on their website that, again, addresses those 3 questions. Great opportunity, and he may have already done it, to communicate that out to his patient base in an email, right?
Yep.
But you're right, COVID-19 and just those words itself are turning into wallpaper, and you do have to definitely stand out and be different.
Yep, absolutely.
Great point. Social media communication. I think most practices now have audited the queue a little bit, but again, I still have seen some practices, just kind of with their social on full blast, and you just need to audit the content to make sure that it's relevant. Think about, again, you're getting your feedback, right? So you're getting feedback on, the companion, right? So reinforcing that message is a great opportunity. And if you take in, what can you expect? Mask, no mask. So your second key message, and you can break that up into 3 or 4 different social posts, right? So everyone who's in social, the hardest thing to do is to create content. But think of it as a menu in a restaurant, and you're picking up these entrees, and in each one of these entrees, mask, screening, etc., and then communicating that via social.
So how often should you actually be placing something on Facebook or, any of your social media avenues?
Yeah, it really depends. Again, based on that feedback, how much you're getting in, are there hot buttons you need to address immediately? But I would say at a minimum 2 times, and then just using your internal feedback that's coming back into you to determine if you need to dial up a message.
Okay, so 2 times a week.
Yeah, that's what I would recommend 2 times a week for sure.
Okay.
Yep. And the other thing you have to keep in mind too is you're getting back to business, right? You're back doing cataract surgery. You're back doing LASIK. I mean, you're back doing, your normal course of business. So you don't want to exclude those messages, but they definitely need to be timely and to the right audience. So, I guess my point here is, dial down your marketing message a little bit. Focus on the safety message and the what can you expect message, and then slowly infuse your marketing messages.
So more education than salesy.
That's right. Yep. Great point. The next one here is a free opportunity. So your Google My Business listing gets more traffic than your website, hands down. This is the business we're in with online reviews and actionable feedback, and they've got a great opportunity out there. I've seen some really creative messaging over the last 10 days on this opportunity here. And one of the simplest things, Jill, and again, we've been talking about it, is just to say we're open and we're seeing patients. And it's you go into your Google My Business listing, you sign into your account, and right under posts, it says COVID-19 update, and Google's done a great job here. So it's an opportunity to add another message to your Google My Business listing, sitting out there with your reviews, your phone number, your website. Again, it won't take text, so don't put your phone number, don't repeat your phone number in it, but definitely put your.
So I think this is one of the best kept secrets, because I would say most practices are totally unaware of this. Most businesses are unaware of the ability to do this as well. And considering that most patients or customers, they're looking online and doing a Google search for your business, this is what's going to pop up first. So to be able to have a message saying that we're open is great, because quite frankly, right now, you call any place or look up any place, you're not really sure if their hours are correct or not, if they're open or they're closed. It's really hard to tell unless you call them. And, sometimes you get a message. Sometimes I call businesses and there's literally nothing at all. There's nobody answering. There's no message or anything. So I think this one is really helpful to say that we're open.
Yeah, and it's free. So it's free. It's got huge reach, right? Google's the 800-pound gorilla, so it's fantastic. We did a study of online reviews, and we looked at, one of the things was the patient experience. So we hooked up all of our hoses to a ton of ophthalmic practices nationwide, and we pulled that in and we aggregated the data, and we determined why basically there are negative reviews. And one of the biggest patient complaints or feedback, and number one was wait time, and number two, it did not receive a thorough exam. But, as we've talked about, Jill, what are your thoughts on, what this might look like in the next, 2 or 3 months?
Yeah, so what's kind of interesting too is I was talking to a physician this morning down in Florida, and he said, yeah, we finally got rid of that number one patient complaint of wait time. So it takes a pandemic to get rid of that number one complaint of wait time, because now they have to get patients in, they have to get patients out, and they're moving much quicker than they used to. So it's kind of funny how it takes a pandemic. But anyways, yeah, I think the biggest concern I have with these negative online reviews is, yes, wait time is always the number one patient complaint, but what I'm worried about is we're going to start seeing safety issues as the number one complaint. And so I think this is a time to really be aware of what's being said online on these reviews. And, you might have to tweak what you're doing within the office, just based on some of these reviews that you might be getting. So you've got to really stay on top of them and be aware.
Yeah. Great point. I mean, absolutely. I mean, that's one of the, it was one of the main drivers, right? When you and I first got together and we started talking about, patient communication plan and, what's it going to take and what are the key messages. And as we talked through that, all the thing that kept sticking in the back of my mind was, I don't want any of our clients to get negative reviews on COVID. I mean, I don't want any of them to have I don't want them to have any concerns. We need to make sure that they continue to get that feedback internally. They make the changes, they make those adjustments, because it, I don't want it, overriding these things when it's, safety's always been at the top of a medical practice's.
Yeah.
It's their number one, right? So what's different? What's different is we're just doing a little more in this space.
Absolutely.
The next piece here, patient and physician referrals, leveraging patient education, help drive referrals, referring physician emails, right? It's a great opportunity to reach out to your referring physicians, let them know, look, here's what your patients can expect when they're coming here. Here's the extra steps we've done to keep in place, and then reinforcing your core services, letting them know, again, look, if you're referring out to, retina practice or whatever it may be, it's one of those things you want to let them know, look, yep, we're doing everything that we've done normally. Please continue to send your patients to us.
Yeah, absolutely. And I think these physician referrals, especially for our audience today, a lot of cornea specialists, these referrals are really important. So I think this is one of those things in a lot of practices that they've kind of forgotten about, to be quite honest. Last week, I was on a Zoom meeting with a ton of administrators from around the Midwest, and we started talking about referring physicians. And we were talking about different ideas and what you can do to communicate the message to them. And I could see a lot of surprised faces, because that was one thing that I think maybe they've dropped the ball on a little bit. They were so focused on communicating with patients that they kind of forgot about those referring physicians. So, I think the email messages, everything that you're doing online is so important. I've heard of some practices even doing just Zoom meetings with their referring physicians, talking about what those safety measures are that they're putting into place. And that can be really valuable. Also, even with, the optometrists that are referring to practices as well. They're getting a lot out of these Zoom meetings, even, shortened ones if necessary, just to kind of keep that communication going.
Yeah, that's great. The other piece of this here, again, as your patients continue to drive, word of mouth referrals in, obviously they're, continuing to write online reviews, but, you don't want them going back, obviously, to that referring physician saying, look, I had a bad experience here. You just referred me here. So again, it's, why that actionable feedback is just so important. You can take what you're doing, again, the second and third key message. So what can you expect, extra steps to keep it to keep us safe, and developing any type of patient education brochure, in the office, let them take it. It's a touchless environment. You're not handing it off to them, and it's one of those things that, again, reemphasizes your commitment to them, something you send them home with, but the opportunity to, and again, you can include it in your existing educational brochures that you may already have, that just reinforces your safety commitment.
Yep, absolutely.
The next piece, scheduling. Scheduling is extremely tough, right? It's a very tough job. There's a lot of expectations to be set up front here. I think my mind just starts racing when I think of scheduling, right? So what type of appointment do you want is the first thing I think about. But, what can you expect when you come to our practice? And this is an opportunity of why, going all the way back to the beginning of where we started with your website, why your website is so important. Because, if you have a call in queue or you have 20 calls in queue, because there's pent-up demand for your services because of stay at home and people have not been out, and you're a very busy practice, and by June 1 I'm going to be at 75, 80%, maybe even 100% from some clients I know in the Midwest and on the West that opened up a little early. You might need to direct them to your website to learn more, right? So you've covered the basics, you've covered the mask, you've covered the companion piece, you've covered the screening component, and hey, by the way, we're doing additional safety measures. Please check out our website. So, big opportunity in scheduling. A script's always a great opportunity. That's just a very small checklist there, but something that's very important. And one of the first touch points that your patient has.
Yeah, absolutely. And I think changing, evolve. We're going to be going through this for a good, 6 to 12 months, hopefully not longer than that. I'm trying to be optimistic. But I think you've got to really have that communication piece so that you're meeting with your scheduling team, maybe on a weekly basis, just to see how patients are handling the information that you're providing to them. Or maybe you have to kind of adjust what that script looks like and how you're communicating to patients or what you're communicating to patients over time. So, some sort of a weekly meeting, I think, is really beneficial.
Yeah. More communication.
Yes.
The better right now, for sure.
Absolutely.
The last slide here is other communications to patients. So waiting room TV. If you have a waiting room TV solution, you have to think through kind of each one of these one at a time. But a waiting room TV solution is a perfect opportunity for question 3. So what are those extra steps that are keeping patients safe? Text messaging, again, think about what is my one thing I want to communicate. We are open, and you can include obviously a bit.ly, a short link to drive them back to your website to learn more or to watch your video. Signage, on hold messaging, again, you're on hold because I'm on hold because I'm explaining all of our safety measures, right, to one of the patients. But, it just reinforces those steps that you've taken. And my, a big advice here is, just think of it as what is the purpose, right? So what's the one thing we want to communicate here? And that will help you get to the key message, whether it's.
I think that on-hold message sometimes gets lost as well. That's kind of like the last thing that seems to get changed or adjusted during this time. So that's something that I think is really important for patients calling in. Again, more reassurance for them. Good time to bring in Dr. Cervantes. Hi, Dr. Cervantes. How are you?
Hi, Jill. Good. Thanks. How are you?
Good, good. Looks like we lost Ryan.
Like that.
Could you share with us a little bit about what you have done in your practice to really prepare for opening up and how you're communicating with your patients? I saw the video that you did that you put online, which is fantastic.
Well, good. I'm glad somebody's looking at it.
Yes.
Well, in terms of reopening, I'm just really glad that a lot of the things that we decided to put in place have been part of your slides. So that's really reaffirming. And
good.
that we're doing something.
Glad.
Well, in terms of reopening, it's like we never really closed. So I guess this is something that's really common for a lot of people and a lot of practices where we sort of had to remain open for emergencies. So this sort of addresses that first question of yours. When the pandemic broke out and the government, the local government said, essentially only essential businesses should remain open, we had to taper things down. And just for our own health, not knowing exactly what we were in store for, decided to shut things down. alert our referral sources and anybody calling the office that we were just really open for emergencies only. And it's funny what people will deem an emergency when there's a pandemic going on. You know, all of a sudden nobody's calling for, you know, red itchy eyes anymore. You know, and then for weeks, that's all we did. You know, because we didn't know what was looming over the horizon. In me and my partner's minds, we didn't know what to look out for, what signs to look out for. We were following the curves just like everybody else was, I imagine. And then one day at the end of April, we were on a call with the medical director of one of the local hospitals, who said something to the effect of that they were noticing that people were dying, not from COVID, but from other underlying health issues, like, you know, their underlying cardiac disease or what have you. And he made it a point to say that we shouldn't ignore these other. Hi, Ryan. I think you're still on mute. There you go.
Hey guys, sorry about that. I had a little bit of power outage, but please continue. I'm going to get your slides up right here too.
Okay. Well, the you know, that local medical director was saying that we shouldn't ignore our patients' other underlying health issues, and that was almost like the you know, the rising sun, you know, in terms of you know, how should we start planning for you know, to address our patients' vision issues. You know, it might not be high priority, but it you know, it certainly is up there. And patients were certainly calling with you know, with their problems. You know, in the time that this is going on, we were reshuffling patients, and I guess you can go on to move in 2 slides. Yeah, so, you know, the challenges as a practice, you know, we had to address me and my partner's problems and challenges with our own health, the health of the business, the challenges of our staff. You know, they were really anxious about the pandemic, and certainly a lot of them have their own health issues to worry about, you know, in terms of high risk and morbidity and certainly mortality. And then, you know, finally, like, what do we do about our patients? So we're just sort of juggling our patient schedules, you know, moving non-urgent patients out maybe another month or 2, you know, but then eventually we have to sort of revisit those patients and see what's going on with them.
Yeah.
So as time went on, you know, the local government was sort of giving us some guidance as to who can open up and what can open up. Our local hospital was doing the same thing too, with you know, getting more testing available and sort of giving us an idea of when the operating rooms will be opening up. You know, and we use that as a barometer of how quickly we should be moving.
Sure.
Right? Because if the operating rooms are opening up, then maybe then we need to sort of use that operating room time, you know?
Mm-hmm.
So, you know, I guess if you didn't see the title of my slide, it was called Reopening, you know, our experience over the last 2 weeks or 4 weeks or however long it was, you know, who's counting, because we never really closed. Over the last, I guess we can say we officially reopened 3 weeks ago when the operating rooms reopened. And we used the time prior to that to get, when I say I mean me and my partner's heads around it. But we also had to make sure that our staff was, you know, behind us as well, you know, because without them, you know, we can't really see patients. And if the staff isn't feeling good about seeing patients, well, then our patients aren't going to come either, you know, so
Right.
there was that level of making sure that that everybody was okay before we started seeing patients again,
Yeah.
or at least seeing more patients.
Yeah. So did you have a chance to really put together this whole patient communication plan before you really reopened 3 weeks ago, or has this been something kind of in progress through this?
Well, it was definitely a work in evolution.
Yeah.
We didn't really care. No, I don't want to say that. We didn't really mind the decreased patient volume because we knew we weren't prepared for anything more than that we were seeing.
Sure.
You know, because our staff was anxious, we weren't necessarily asking them to expose themselves to patients if they didn't know if they were positive or not. So, you know, what we did as the doctors is we were working up patients ourselves, you know, and asking the staff just to do ancillary stuff and really limit their patient exposure. I mean, there really was a high level of anxiety around here. And there still continues to be, you know, and we can talk about that in a little bit too. So once me and my partner decided, we can go on to the next slide. Once me and my partner decided that it was time to move on, you know, things that helped, you know, make that decision were, you know, the local government and the local hospital saying it's okay. We were fortunate enough to get, you know, a PPP grant from the government, which helped with payroll. It also helped for us to kind of stay in our, you know, kind of normal routines. You know, it's one of the challenges was that it's actually kind of nice to be at home, right, with our family and kids, and at least for some of us, right?
Right.
For a certain amount of time.
Right. Yeah.
But still getting up early, kind of keeping busy at home was something that at least I, you know, made sure to continue doing. And then webinars like this were very very helpful in getting our mindset around it. So the next slide, please, Ryan. Like you had said, open communication with our staff was really important. Some of our staff members I haven't seen in like 2 months physically, you know, but thank goodness for Zoom and you know, apps like that. You know, we had bi-weekly meetings just to make sure that everybody was on the same page, and just a sanity check. Some of our staff members also haven't seen members outside their own family, you know, for a long time either, or had conversations with people. So this was a welcome sort of get together, you know.
Yeah.
So in getting together with them, we were able to communicate with them that nobody's getting fired. You know, the grant came in, and you know, we were fine financially, at least, you know, for the time being. And then we were able to hear what challenges they were having, you know, not only personally, but you know, the front desk. How many people do we need at the front desk? How many staff do we need seeing patients? And from there, we were able to kind of adjust our staffing schedules, and from there adjust, you know, some of our patient schedules. You know, during this time of emergency only, my partner and I were dividing the week between us coming into the office every other day for maybe only half a day, because that's really all the patient volume that we were seeing. Once we really came up with a plan, that call that I described to you before about not ignoring our patients' health needs. Once my partner and I had that in our heads and used that as motivation and explaining that to our staff kind of got behind that too. We weren't just another business trying to reopen, you know, for economic reasons. There were people depending on us for a variety of reasons, and we had to be there for them. And I think that mindset helped them kind of, cross that threshold into, you know what, working 1 or 2 days a week was nice, but, you know, we do have a responsibility as a practice to get out there. From there, in trying to see what is what's creating anxiety with regards to COVID and our staff. We wanted to hear what would make them sort of feel better, and a lot of that was just disinfecting protocols, making sure that everything is clean, limiting the flow in the office, limiting the patient face-to-face time, procuring PPE, so everybody is essentially safe, and that lowered the anxiety level. That allowed them to dictate, our staff to dictate how many patients we could see, and this is great, because the staff is saying, I think we can see a little bit more, and I think we can see a little bit more. I think we can extend the day. They're the ones who sort of who dictate our days,
And then how did you communicate all that with patients that you were ready to take them on?
Well, that I guess comes on next. You can put on the next slide. Once that safety plan was in place and our staff was comfortable with it, they were able to communicate this to patients on their own. Mm-hmm. The main avenue for us, as much as we have a website and social media, is really over the phone. Patients call all the time, and we have more encounters by phone than any other means.
Absolutely.
Once the staff had our safety plan in place and they were confident with it and they were confident in seeing patients, I think that comes across in the way that they're talking to patients, and that's making them comfortable. Again, if we can open a practice, but if the patients aren't confident that we know what we're doing, then they're not going to come.
That's right.
Absolutely. Very, very
That's
true.
Right. Are you guys are 100% fully operational at this time?
I don't think anybody really is, but we are definitely not.
Okay.
I would probably say that our patient volume is at about 30% capacity.
Okay.
We, instead of just emergencies though, we are seeing new patients and consults, things that we feel comfortable, rather prioritizing. So, things like routine exams, glasses checks, annual exams, they are kind of getting juggled back out again,
Gotcha.
But, it's sort of like the juggler was able to juggle 3 balls. Well, now we're able to juggle 4 balls and then 5 balls. And, the new patient consults are coming in, the procedures in the office we're starting to do again, because those are the ones we're really prioritizing, right? The surgical consults, the things like LASIK and elective procedures, things like that. Those don't require a tremendous amount of time and resources, and financially it helps the practice kind of get some revenue in the meantime.
Yep.
Absolutely.
I loved your guys' video. It was very well done, and it covers really what we talked about, right? So it's who are you seeing? It's what can they expect when they come into the practice? It's visual, right? So you're speaking to 65+% of the audience out there. So first of all, phenomenal job on the video.
Thank you.
Was the sign by design that says this room has been sanitized, or was that an internal staff thing? That was fantastic.
Staff thing. So with all of these different safety protocols in place, it creates a lot of inefficiencies. That's why our patient capacity is so low.
Sure.
We have to worry about sanitizing rooms. We have to worry about minimizing the flow in the waiting room, minimizing the working with a reduced staff. So these like the sanitized room, sign, the signs on the chairs that say "Don't sit here." Those are all placed by staff to communicate with each other.
Yeah.
You know, without actually speaking to each other.
Yeah.
Just one way of creating an efficiency out of an inefficiency.
Yeah. Yeah. Well, great job. I mean, that's one of the big things we're seeing right now is, like we mentioned, patients want to actually see, the sanitation process, whether it's the temperature, reader being wiped down before it's being used, or, the equipment being wiped down. And I can tell you, pre-COVID, that was not something that was, top of mind, obviously.
Yeah. Certainly. I mean, we just had an incident here today, where the anxiety levels easily, go up. One of my staff members' mask kind of snapped and kind of fell down, and patient, was like, "You can't have that. Oh my God."
Yeah.
So we try to do everything that we can,
Yep.
as I said, to at least make it look like we're cleaning everything, and which we are. And
Well, yeah, totally. You're doing those things. It's a heightened level of sensitivity, right?
Right.
That's it. Accidents happen, the mass break, and that's what happens. I mean, I was outside walking and I sneezed, and my neighbor, who was 2 houses over, is like, "Hey, be careful down there." And I'm like, did he just comment on my sneeze? And he did, because that's what we're in right now.
Yeah.
That heightened anxiety. Yeah. But as long as you have everything in place, it'll all work out, right?
Yeah, we hope. All it takes is right. It's not just for show, right? We are doing these. We are
Absolutely.
doing this for our safety, for the safety of our patients.
Absolutely.
The last thing we need is to have an outbreak, going through our office, and all of this work to get to this point, will have been sort of backtracked, 5 steps backward.
Absolutely. Absolutely. Well, in the interest of time, I noticed it's now been an hour, 6 o'clock. Michelle, did you have any questions?
Yeah, we do have a couple of questions in the queue, if you guys are ready to go over those.
Sure, if we still have time, that'd be great.
Sure. So the first question is, what is the best channel to use to communicate with your patients?
Wow. I'll take that one at first. Big question. I would say, there's no silver bullet, right? So Dr. Cervantes just made a great point, right? 90% of his communication is done over the phone. And so for him, that's his best channel to communicate, because that's where the most volume is. I'd say scheduling, obviously, number one, that incoming piece he talked about. Number two is an easy one, in my opinion. I would say, an email, because, you want that existing patient base. Those are your existing patients. They're going to help fuel your growth. That'd be number two. And then number three, I would say, your website, we talked about, it's your employee who doesn't have any issues, and they're perfect, and just keeping that update. I'd say those are probably the three. Jill, your thoughts?
Yeah, I would agree. And I'm thinking over the years, I've had some practices tell me that they didn't collect email addresses, and I'm sure they're really regretting it right now, because email is a great way to send out communication. It doesn't cost a thing, and
right.
You can be very detailed with that information to make patients feel more comfortable coming in.
That's right. That's right.
And then in follow-up to that question, how do you determine if your patient communication plan is actually working?
I think you'll really hear from your patients, either verbally when they're in the office, by phone afterwards, or on those online patient reviews. You're going to get a lot of feedback that way. I'm sure Ryan would agree with that one.
Yeah, absolutely. And I'd even ask, Dr. Cervantes, I mean, your experience, right? You're seeing patients, even though it's a reduced, workload for you, but, I mean, these patients, I mean, they're probably providing you feedback, just like that example you had earlier. Are you hearing feedback from patients?
Yeah, fortunately for us, we're getting more positive feedback than negative feedback.
Great.
Patients go out of their way to say how comfortable they are.
That's
not
awesome.
in a full, not seeing a full waiting room.
Yeah.
They comment on that they're happy to see us cleaning the rooms.
Yep. Yep.
Yeah. When we instituted the curbside check-in, they were really thrilled about that, that they were more comfortable in their cars than in our waiting room for sure.
Gotcha. So your process now is I call the office when I get there and I get parked, and then you tell them when it's time to come in for their appointment.
Yeah, exactly.
Yeah, that's great. Yeah, that's fantastic. Awesome. But Michelle, any additional?
Yeah, one last question, and I do have one comment, so I'll read the last question first. What is the most effective way to communicate with referring physicians?
I guess I can tell you what we did.
Yeah, let's hear it. I think it depends. Yeah,
you're
go
right.
ahead.
It depends. Some people have their referring physicians' email addresses, and we don't. We're old school, and we have a fax machine. So we just the other day we typed up a letter saying that we're reopened, and we want to be able to provide the same level of care that we had before COVID, but with this this new plan in place to keep their patients safe, and we fax that over to their offices.
That's great.
That's great. Yeah. And I'd say, you could also email to your referring physicians if you have their email addresses. I've seen some practices do some great Zoom meetings, something kind of short and sweet just to communicate with them and to kind of go over what some of those processes are. Even like the video that you just did, Dr. Cervantes, that'd be a great thing to share with some of your referring physicians. Whether it's through email or even, on a LinkedIn page or something like that, where a lot of physicians connect with their referring physicians. Even posting that on LinkedIn might be valuable as well.
Well, thanks. I do want to give credit where credit's due. The video was inspired almost verbatim by another cornea doctor named Bill Wiley out in Cleveland. Literally almost verbatim, but
great job, Bill.
Our staff.
Shout out. Hope he's watching.
The best ideas are those that are borrowed.
That's right.
Why recreate the wheel? That's right. Great job. Right. Yeah, it was very, very well done.
Okay, and then we just have one comment from David Bosch. Jill and Ryan, thank you for the awesome presentation. Your expertise and step-by-step guidance will prove to be invaluable to our surgeon partners' practices. I definitely will be stealing a few ideas for our communication plan.
Awesome.
And thank you, Dr. Cervantes, for sharing your experience and insights. So on that note, we don't have any additional questions. So I would like to thank everyone again for joining us today. The webinar has been recorded and will be available on our website to view on demand. So again, a special thank you to Jill Marr, Ryan Schumacher, and Dr. Cervantes for serving as today's speakers and providing us with your invaluable expertise on this subject. Have a great evening, everyone.
Thanks, guys.
Thank you so much.
Bye.